welcome, everybody. Good morning, good afternoon, and good evening, wherever it is you are in the world. And welcome to this webinar. My name is Gary Hickey, and welcome. This is a webinar hosted by the International Patient and Public Involvement Network. Please do say hello in the chat function and let us know whereabouts in the world you are from. Before I introduce our two wonderful speakers, I'd just like to do some quick housekeeping. So Heidi, if you could please show me the next slide. Thank you. So the format of this webinar is that Silke and Isabel will do a presentation. They'll be speaking for about 20 to 25 minutes, following which there will be a question and answer session. Your microphones will be muted for the entirety of the presentation, obviously to prevent background noise. If you would like your subtitles to show, then please do click on the CC Show Captions so you can get the subtitles on your screen. We will, as I say, have a question answer session, so please do use the chat function to ask any of your questions, and I will be monitoring the chat function, and I will present those questions to Silke and Isabel. So that's all there is in terms of the housekeeping, and I'm now delighted to introduce our two wonderful speakers, both from Humboldt University in Berlin in Germany. And please do correct me, Silke and Isabel, if I pronounce that incorrectly. It's highly likely I have. So we have here Dr. Silke Lipinski, who's a postdoctoral research fellow at the Department of Clinical Psychology of Social Interaction. Silke is a patient and public involvement consultant in clinical psychology and psychiatry, and coordinates a Centre for Patient and Public Involvement in the German Centre for Mental Health. And Silke is joined by Professor Isabel Dziobek, who is Chair of the Department of Clinical Psychology of Social Interaction, and is also head of the Berlin site of the German Centre for Mental Health and lead of the patient and public involvement infrastructure in the centre. And so today's webinar is about embedding patient and public involvement in the German Centre for Mental Health. So without further ado, thank you, Silke and Isabel, and I shall hand over to you.
Great. Thank you so much for the invitation. We are very glad to be here. And as you said, Gary, Silke and I will be presenting together. So I will go ahead and share my slides, and then Silke will have a start. Here we go. I hope everybody can see the slides now. And here we go, Silke.
Thank you, Gary, for the nice introduction and the invitation. Thank you, Isabel, for sharing the slides. And thank you, everyone, for coming this afternoon, being interested in how we did include patient and public involvement in a rather large research structure. And we are here as a team because we usually work in a team of people with lived experience. That's on my side in the field of psychiatry and clinical psychology, and the research partner, which is in this case Isabel. And after a couple of years, we think it's always a good idea to work together wherever we do get to show that we are really convinced of working together in a PPI structural team. So the German Ministry for Research found out, or kind of recognized about 3 years ago, that there should be definitely some improvement in the research done in the field of mental health. And one of the reasons why there was, from the beginning on, quite a focus on that there should be patient and public involvement in research structures which might be funded. I present this here because that's a meta-analysis of a lot of studies that looked at metacognitive interventions for individuals with mental health disorders. And they finally did a focus group and asked psychiatric or former psychiatric patients for what are actually the outcomes they are looking for. That's too far. Yeah. Thank you. which are the outcomes that actually patients are looking for in interventions. And the patients named that metacognitive changes in quality of life were major outcomes they actually asked for. But those were analyzed in about only a quarter of the studies that were analyzed in this meta-analysis. And any other outcomes that were desired by patients, which they found highly relevant to their everyday lives, were analyzed in absolutely none of the studies. So that meta-analysis shows that it sometimes falls apart a bit what researchers look at and what might be important for the broad public living with these conditions. And I have this little cartoon here, which I think kind of entails really nicely that it's really valuable to do fundamental research, and we need to do peak research with very exciting experiments, but we also need to look at bringing these results and bringing the technology from those to the broad public, so almost everybody or most people can make use of what is out there in science. And so about 2 years ago, we went on a journey together and were able to introduce a PPI structure to the German Center for Mental Health.
Thank you very much, Silke, for the introduction. I will take over. Later, Silke will then resume. I would like to tell you a little bit about the German Center of Mental Health, what it actually entails and includes. The funding started, sorry, for some reason these slides are independent from my clicking them. So 2 years ago, the research the funding started for this large research endeavor, which is really the largest mental health funding that has been taking place ever in Germany. And the German Center for Mental Health includes 60 research projects currently, more than 250 PIs and approximately 500 early career scientists at 27 university and university hospitals in Germany, as well as non-university research institutions. Here on the right side, you can see the map of Germany, where the different partner sites are located in Germany. The research foci that we work on are first risk and resilience factors for mental health and somatic comorbidities across the lifespan, then innovative individualized interventions. The third one being prevention, recovery, and participation in everyday living environments. And fourth, visionary research on emerging questions. So whatever comes up de novo. The central missions, you see a summary of the 6 central missions of the German Center of Mental Health here, and I really want to highlight here only number 5, which is that we set out to establish a national standard for the involvement of patients and relatives in health research. So this is in Germany actually pretty new for mental health research, and I should say that it is actually in general in healthcare something that's far not as developed as, for instance, in the UK or also in other countries such as the United States, for instance, or Australia. So for us, it was a pretty new endeavor that now has been going on for 2 years. I guess you all know what patient and public involvement is. I still would like to say just a minute about how we also, what terms we follow when we say PPI, patient and public involvement. So for us, it's the actively working in partnership with patients and members of the public to plan, manage, design, and carry out research. It is really research that is being carried out with or by members of the public rather than to, about, or for them. Yeah, and here on the right side, you see the stage model of participation, and you see that real participation starts at these upper 8, 7, and 6, these steps of the ladder. So where actually some kind of shared decision making is realized, and this is exactly what we are trying to realize at the German Center of Mental Health, to involve patients and also relatives in the research with some decision competency. And the reason for why we do is is not only because it's ethically and legally indicated, as for instance defined in the UN Convention of the Rights of Persons with Disabilities, as you probably all know, but it also we know now by a lot of research, also quantitative research, that PPI makes science better. It makes it more relevant for stakeholder groups. It helps prevent dropout in studies. It saves costs. And it also has a positive effect on researchers and experts by experience through the mutual learning that takes place here. So many good reasons to do science together. The areas of PPI that we integrated at the German Center of Mental Health span these areas here: political participation in blue here, then participatory research, and we have an infrastructure at the German Center of Mental Health which basically enables or supports these two large areas of participation. And you will find these colors again in the next slide that I will show you, which is much more complex. So I thought it was good to show you this in a simplified version here. So you look out for these colors again. Let me push a little bit away the viewing window. I don't know if it actually disturbs your field of view too, or just mine. This infrastructure that was in orange before here, the Center for PPI, is here now in the middle. We have dedicated personnel that supports political participation here in blue on top of that slide, as well as in purple, participatory research. So as far as political participation goes, we have a trilogical board for the whole center. This board actually has 36 participants, 2 patients, 2 relatives, and 2 researchers per partner site, per 6 partner sites. So we have all in all 36 people that members of this board. Then we have on the right side here trilogical site boards. So in each partner site we have boards these boards actually have all in all, if you count, 130 participants in total, including actually 20 children and adolescents that are organized in dedicated child and adolescent PPI boards. And here on the top left side, you see that we have actually 20% voting rights for patients and relatives in the most important executive committee, the German Center of Mental Health Steering Committee, which includes the 6 spokespersons of the center, as well as 1 patient and 1 relative representative that is voted by the trilogical board here. So you see there is decision competency actually even at the highest level of decision making in the German Center. Down here you see participatory research. So the Center for PPI with this personnel helps to establish center-wide advisory and support structures for participatory research. It is responsible for PPI quality assurance and coordination of the internal PPI reviews, which I will get to a little bit later on the next slide. Yes, and I should say that we have one full-time researcher per site in this PPI infrastructure. Here again, the PPI infrastructure tries to enable participatory research, and obviously we seek to involve patients and the public really in every step along the line, the research pipeline, starting from finding topics for research, over involvement in methods, and also data collection, as well as dissemination and output of results. And here you see a few examples of where we support participatory research and political participation. So we, as the PPI infrastructure, coordinate these trilogical board meetings and issues that come up. We qualify and advise and onboard the members of the trilogical board and recruit them also. And then we support and do quality control for the participatory elements of all projects in the German Center of Mental Health, including user-led research. Silke will tell you a little bit about the user-led research that's going on at the German Center of Mental Health, which we are actually very proud of. So we try that always there's one at least user-led research project that's going on, that's thought about or envisioned by our triological board. Then we come up with training and curricula for researchers and experts by experience for PPI, together with the academy. That's an infrastructure that's dedicated to continuing education. What we do is we develop declarations and guidelines for participatory research. We develop tools such as how to do focus groups, citizen science, and so forth. We help the matching of experts by experience and researchers for joint projects, because that's often a problem for researchers to find the right group of experts by experience to work with them. We help with the training and the installing of reviewers for intramural funding. So our grants are also always appraised with respect to their PPI elements, and that's done by experts of experience. Yeah, we help recruiting staff that have scientific staff that has also background as experts of experience. And finally, we establish a network with external PPI experts. And as part of this, for instance, we are giving this presentation today. And with this, I'm handing over to Silke for the last part of the presentation. So this is just an example, sorry, that was my last slide, for one of the documents that we are handing out at the beginning of a project. It's a documentation form and consulting form that each project that is done at the German Center has to fill out. It's adapted at the GRIP 2 guidelines. And it is really there to remind all PIs, principal investigators, to integrate PPI elements in their projects and for us to document and support them in that.
Thank you, Isabel. Thank you for introducing us to two of the three columns of our PPI structure in the German Center for Mental Health, which is the political participation and participation in research projects. But our developing process also showed that we have a strong need for our own user-led projects, which have topic decided by patients and relatives, which will be conducted only in teams with a majority of patients and relatives. And so we decided we always try to have such a project. And I would like to introduce to you our very first project, which we just gathered final data, and I'm able to give you a little sneak peek into some of that. We set out on a multi-step process by at first collecting research topics in an open contribution format on a website. And then in a second step, we had the public decide on which are prioritized. And we did so kind of closed, related to the process of the James Lind Alliance. However, we left it a little bit adapting to our German needs. What we set out to do with this is to establish such a thing as sort of a research compass, which the compass should somehow guide or show the direction for research, which way to go. And the reason for that is that we so far don't have anything like that, like the James Lind Alliance priority lists in Germany. So we set out to find out what actually patients and relatives would see from research, which is publicly funded. And here you can see a little bit of how this looked at the website. We did notice that there's a broad interest in participating in such a project. We had more than 1,500 contributions by text and did a qualitative analysis of this. After that, we had groups of self-advocates and self-help organizations establish a final list of 20 research areas or topic areas, which then were given back into the public for establishing a priority list. And there you see we have more than 6,500 votes in this process, on the prioritizing process. Go to the next slide. A bit different than what the James Lind Alliance process is that we did not have very individual groups of people, but we set out to ask the whole group of people with mental health issues or mental health problems. So these are the numbers of contributors, and you see they're a little bit similar to how often or how frequent mental health disorders do appear in our population too. So very often there's depression, anxiety, very frequent, but also addiction and post-traumatic stress disorder. And those were also the four most participating groups in our survey. What also is a bit different from the James Lind Alliance and what we deemed important is that we continued to look at relatives and people with own experience separately and see if there's any differences or if they all have very much the same needs. So after very thorough data cleaning, we do have more than 5,000 data points to analyze and look at what actually is demanded by groups with these mental health disorders. The next one. And for our compass, this is a little preliminary result, but it's kind of, we're getting there to establishing a list of the top 5 research projects, topics, which are just equally important to relatives and people with lived experience themselves. And overall, number 1 topic was voted for improvements in our healthcare system. There is a lot of country-specific issues in the healthcare system, which obviously do need some improvement, and it was voted up on the first rank to, for example, see how can access to medication be improved, how can a lot of the paperwork and legal processes can be improved. And actually, how can different providers work better together so that it's not falling apart? For example, psychiatrists are a group that a lot stays among themselves, psychotherapists stay among themselves. If you go in an outpatient setting, it's kind of separated from hospital settings, and these things are relevant issues to the stakeholders. But also very much it was asked for visibility and participation of patients much more in the healthcare system than it's seen now. Also, other topics of interest are causes of mental health issues. Our number 3 is non-medical treatment, and that's very interesting to us because a lot of money in research goes into finding treatment or medical treatment. Also, we see diagnostic processes are a focus, and of course, care and support systems and how they can be improved. And then the next slide, please. The large contribution of stakeholders allows us also to look at individual topics and whether they're similarly important to each group or if there's something that stands out. And here you can see on the left side that non-medicinal treatment is very important to almost all of the groups, but it stands out that the group with bipolar disorder, with experiences of bipolar or anxiety, are actually very much interested or more interested than other groups for this topic to be picked up more. You can see in the course of life, it's very it's important to all of the groups, but it really stands out for the group with addiction experiences. That should be a focus also to have the whole life cycle in focus. And on the right side, you do see the topic of, like, for example, legal support and effects of experiences of violence, and that is something that sticks out very much for the people with post-traumatic stress disorder. So we are able to see which group has very strong interests in which topic or areas of research. The next slide. And what we also are able to look at with this kind of project is whether relatives and people with self-experience in this field of mental health do have different interests or needs in mind. I just have a few examples here. This is the group of people with autism, and you see the blue dots are autistic people themselves, and the red dots are the relatives that contributed to the project. And for a lot of topics, of a lot of content, it's not that far apart, but there is some quite obvious differences, for example, on the prejudice and social discrimination, which you see here on the bottom. This very obviously is a much more important topic to the people that actually live with the condition, which doesn't seem to be as much of a concern for the relatives themselves. So it's nice to see that that there's maybe even differences in those groups. So last slide, or next slide. Well, after showing you these three pillars of participation in the German Center for Mental Health, it is of course obvious that nothing runs without any issues or problems or hurdles, and of course we do have them. And being the very first one with such a large structure in a health research infrastructure, we of course run into common problems, but maybe also some specific ones. I think it's very common that access to resources is always of concern. It's important. It's also always an important discussion. How can we do some compensation, monetary compensation? But also it's actually a research network for basic research or fundamental research, and participation is especially difficult or challenging in very basic research projects, and much easier to do, for example, in care research. But we also have specific problems, for example, because it's a mental health infrastructure. Psychiatric patients do sometimes make not the best experiences, and there is a lot of mutual fears and concerns when working with researchers and patients. It's on both sides. We see this both directions. Partly contributing to this is also the perceived power imbalance, but there is, of course, also power imbalances. We do need to work on communication. It's difficult to have researchers' language and lay people language continuously in every part of the structure, in the political process, in the research, continually. Always we need to work on this communication process. And of course, very common problems, or let's say considerations, like how can we achieve representativity? How can we match people with lived experience best with research projects and researchers? And of course, it's always around that we do try to avoid or not to enhance tokenism, but with something that is very new, this is always there's always a fear, and there's always possible that that this happens, but we need to keep it in mind, and it's basically very much what we try to work against. Next slide. So some of the ideas we would like also to share. What does it take to get such a structure in an institutional context running? It does need time, resources. It is very much underestimated. Participation, or PPI, is work. It's intensive. It needs. It can't be done on the side. But a lot of times processes take more time. When there's the more stakeholders you have, the longer it actually takes for doing that. And that's for both groups. It's for researchers and people with lived experience alike. Underestimation of how much time and work it is seen in both sides. So it needs to be very transparent how much a process will actually demand time-wise, for example. Also, financial resources, it needs clear responsibilities, and something in research which is difficult is that we need really reliable and long-term funding for PPI, because it's not possible to set up structural PPI if you have funding for 2 or 3 years and then you don't know whether you're continued or not. Same with continuity. Stakeholders might have real life issues, but also researchers maybe change their position. That's always a struggle, how to have continuous work in PPI. But something which is, I think, perceived all over is that we need training for researchers and people with lived experience alike. We're happy to see that we have an opportunity to establish such, but yet we're not there. We need to build up these structures and also formats for exchange. And I think one very important issue is incentivizing doing PPI. for both sides, again, for researchers and people with lived experience. It should be a good experience. And for that, we do need a bit of a cultural change. So PPI is not something prescribed to researchers, but rather something more and more researchers feel or make the experience what it can do to the research process and how it enhances results and their own work. And once this experience is there, I think, or I very much hope that more people will not need external incentives anymore to do PPI. And with that, I take the last slide. Yes, also we wanted to give you an outlook on what's coming up next. So for the triological board, of course, we have continuing growth of these boards. It keeps us very busy to contribute to all the political boards, but also there's much possibility to become more of a voice for mental health in Germany in public debates. And we're also planning our next user-led or self-help study on mechanisms of self-help, which we have to write our proposals for, just like researchers do. The PPI infrastructure, currently we are looking for more evaluation of impact, training programs, I mentioned that, but also exchanging more experiences with others in institutionalizing PPI and creating working groups for that. The participatory research, we would like to finalize very soon our research compass and then have the research compass inform the projects of the German Center for Mental Health. We just started a project that will establish a research compass with people with ages 6 to 18, so much younger group, when there's way less experience out there on how to do PPI with such young age groups. And also it will be a continuous field of work to support researchers to get the best out of participation in their own research projects, and then in the end, hopefully achieve research which serves people with the lived experience better than possibly before in the very first slide. So thank you very much for your interest in our structures and in our endeavors, and I'm very happy to see what questions are out there.